The next factor in physicochemical property is complexation. Drugs may form complex. For example, aminoglycoside antibiotic form complex with mucin, which is the G protein, glycoprotein of the stomach, and these glycoproteins provide a protective layer to the stomach. So inside the stomach, aminoglycoside form complex with the G's protein. This aminoglycoside is charged drug, and again protein are charged, so the charge form complex with each other, and the absorption is dramatically decreased. Similarly tetracycline or quinolones form complex with calcium or metal, and इसकी absorption decrease हो जाती है. Solubility of drug. So absolute hydrophilic drug, इसकी absorption भी पुअर है, और एब्सोल्यूट लाइपोफिलिक ड्रग, इसकी एब्जॉर्प्शन भी पुअर है. अब बेहतरीन ड्रग फॉर एब्जॉर्प्शन वो है जिसमें हाइड्रोफिलिक लाइपोफिलिक बैलेंस हो, जिसमें हाइड्रोफिलिक पार्ट भी हो, लाइपोफिलिक पार्ट भी हो, इसकी एब्जॉर्प्शन बेहतरीन होती है. तो द ड्रग्स विच आर पुअरली एब्जॉर्ब्ड, वी कैन एक्सेलरेट द एब्जॉर्प्शन थ्रू प्रो ड्रग फॉर्मेशन. Pro drug carrier system. In prodrug, we bind a specific molecule to the drug, which increasing the partition coefficient. Next factor in physicochemical factor is pH of the medium. So this factor I have discussed in absorption video series under the topic Hessenberg equation. Next factor is pharmaceutical factors. So the drug absorption may be affected by the number of pharmaceutical factors. Drug formulation. Drug formulations, it is possible that the drug interacting with its excipients. ये मुमकिन है कि एक ड्रग अपने ही एक्सिपिएंट के साथ इंटरेक्शन कर ले, कॉम्प्लेक्स फॉर्मेशन कर ले, और उसी कॉम्प्लेक्स फॉर्मेशन की वजह से इसकी एब्जॉर्प्शन कम हो जाती है. डोजेज फॉर्म आल्सो is one of the factor for absorption. For example, सबसे ज़्यादा जो absorption है that is syrup, और सबसे कम absorption that is tablet form, and so on. और इसके दरमियान जो है वो intermediate है. Dosage form also responsible for drug absorption. Manufacturing process is also responsible for the modification of drug absorption. If the drug is not properly get absorbed, so maybe there is problem in drug formulation, maybe there is problem in dosage form, maybe there is problem in a manufacturing process. Pathological condition, tumor or fatty layer decrease absorption, malabsorption also decreasing, leading to decreased absorption. For example, in Crohn's syndrome, इस syndrome में villi, the peak of the villi become broaden. अब इसकी surface area कम है, तो due to this decreased surface area, इधर absorption कम होगी. The next factor is drug efflux pumps. These efflux pumps are counter transport protein pumps which expel drug back into the GIT lumen. For example, look this diagram. This is GIT. This is the absorbed drug. This is the absorbed drug. Due to this drug efflux pump, the drug is expelling back toward the GIT lumen. So this in decreasing the absorption. Absorption is cancelled. In this phenomenon, absorption is cancelled. Such pumps are P-glycoprotein (PGP), bile salt transporter protein, multi-drug resistance associated proteins. These are the drug efflux pumps. These pumps help bacteria. ये pumps bacteria में भी पाए जाते हैं. These pumps help bacteria to keep internal environment from these pumps help the bacteria to keep this internal environment toxin free. Even if this bacteria internalizing the antibiotic, through these pump, antibiotic are expelled out, and bacteria is competing with the antibiotic, which is known as drug antibiotic resistance.